Yes, the information that we have on this comes from the Congressional Budget Office, which spends its time trying to analyze what the effect of different laws are going to be on the federal government's budget. They estimate that over the first 10 years that this law is in effect, there will be a savings of over $100 billion, in the range of $140 billion. So there'll be a reduction in the deficit by that amount. And then over the 20 years, the upcoming 20 years, it will be more like $1.3 trillion in reduction in the federal deficit as a result of this legislation. So we're trying to put in place in this legislation provisions that will reduce the growth in the cost of health care going forward. We believe that the legislation contains those provisions, and that will have a great benefit for the federal budget and the federal deficit. Well, there are various provisions in here intended to improve the quality of health care that people receive in the country. What we're trying to do, for example, in Medicare, is move away from a model which we've had in place, where we pay on the basis of the amount of the number of procedures that a physician will perform, and instead we pay on the basis of outcomes. And to the extent that people can get well without as many procedures, we want to encourage that. We want to reward physicians and hospitals that can bring about those results. So we're trying to move toward payment for quality rather than payment for quantity of healthcare services provided.